Hey everyone, welcome back to the Outcomes Rocket. I'm so excited to have you all tuned back in for another phenomenal episode. Today, I have the privilege of hosting Dr. Abbas Zavar. He is a pioneering physician and a digital health leader with over 2 decades of experience in medicine and health information technology. His career encompasses clinical practice, digital health consulting, management, and really just showcasing his tech savvy expertise. He holds a doctorate in medicine, master's in public health, master's in health informatics from the University of Toronto. He's got an incredible story and one that he's going to share today, but really just interesting work that he's up to. So I was so grateful that you joined us today.
Great. Thanks. Thanks for having me.
It's my pleasure. It's my pleasure. So, really just to kick things off, I'd love to just learn about people's stories. What inspired you to focus on personalized medicine, and how do you envision transforming healthcare in the near future?
Great. Thanks again for this opportunity. Yeah, for a long time, I'm a strong believer on personalized medicine. Just imagine that our healthcare system providing the right clinical intervention, whether it's diagnosis, treatment, or prevention at the right time for the right individual. This is fantastic. This is everybody expects from the ideal healthcare system, patient centric. So I'm focusing on this vision for a long time and applying in my job, in my research, in my courses I'm teaching. And because, as I said, this is the ideal version of healthcare system. And I believe all of our healthcare ecosystem, even digital part, out of healthcare system, we should be harmonized through that end goal. So this is that my vision. I'm working on that, and specifically, I'm very interested on prevention section of this approach that I can explain it in detail.
Yeah.
Yeah,
Oh, I think it's great. And thank you. This is where healthcare needs to go. Focus on prevention and from just from the prevention side of things, and we'll get into the next questions here. I mean, what's your thoughts on prevention, say leveraging medications for cholesterol for prevention? Or do you believe more in a naturopathic pathway to prevention, or both?
uh, indeed, we need to consider all of those pathways and harmonize them because we have lots of different situations. But my thought that all of them have to be harmonized together in the one point and point. So, yeah, prevention is the significant gap in our healthcare system. Most of healthcare system, they are only focusing on acute care, ignoring or missing prevention most of the time. And even our healthcare system wants to invest or follow this approach in our current status. We don't have enough data in our EMR system or EHR system. We need to have the full healthcare profile for everybody, each individual. It's not only health-related data, it's about omics, about lifestyle, environmental, occupational, social determinant of health. So we don't have this data in our EMR system. There is a big lack of enough information to have a personalized preventive plan.
Yeah. No, I love it. Thank you for that. And I'm asking you because hey, I just got my labs back. My cholesterol was a little high. I was my doctor and my wife, just kind of thinking about these things personally, as a lot of the listeners and viewers are thinking about this too. Now, I want to zoom into you're working on some research and you have a preventive assessment tool. It's a project that you're working on and it adds value to the healthcare ecosystem. Talk to us about how and its potential impact on preventative health.
Yeah, sure. Yeah. So I very passionate on prevention, personalized prevention approach. As I said, we have lack of data. So for years, I'm thinking about how we can make a tool or approach to capture this data in our system at the point of care for clinicians. So I started from my back home, started in the I was the first founder of Preventive Medicine Institute. We started in this idea and vision, but unfortunately, I couldn't apply it or implement it. Came to Canada, and now I'm following that because it required technology available in the market, digitized form, AI, EMR system, in a primary care EMR system in a hospital, all are available. We just want to connect them in a perfect way. So PAT project or Prevention Assessment Tool project, we want to develop a package of all questionnaires, or we call it PAT, Prevention Assessment Tool, for all aspects of each individual, not only health data kind of available, but about the lifestyle, your activity, your diet, your sleep pattern, your social behavior, your mental, your occupational health, about your environment, everything around you as exposed on chemical, physical, or biological, social determinants of health, even about your situation about high cholesterol. So we don't have enough information about your lifestyle, your personal, to provide you the best personalized preventive approach, even tertiary or secondary. So we want to create that package of questionnaire, validate it, customize it for Canadian healthcare system. And by digitizing them and make it available for physician, they can select any of those questionnaire, patient completed, data enriching the EMR system, and AI are available there. AI can identify risk factor, provide preventive action. So, or indeed suggesting preventive action.
Yeah.
So this
No,
is the summary of our project.
I think that's super interesting. And so are you thinking that through this process, we're going to be getting these questions asked at the point of care, or is that right? Okay, at the point
Yeah,
of,
exactly.
so you gather all this necessary information at the point of care through these assessments. That way, you have a full picture, and you could do more preventative things.
Yeah, exactly.
Understood. Understood. This is super interesting, Dr. Zavar, and just asking all these things at the point of care, integrating them all in a preventative pathway is the way. What would you say have been the biggest challenges that you faced in developing and implementing innovative solutions like this, and in particular, the one that you're working on now?
Um, Good question. For any of innovation in healthcare system, we are facing with data integration, data access, regulations, patient engagement, ethical perspective, or any of them. But to be honest, they are not a significant challenge for PAT project at the moment. We don't have any concern about ethical. We hopefully have a patient engagement because by providing those information, patient will receive a great health support by prevention approach. The most challenge that we are facing, I'm reaching out several AI companies. They have the technology, they have the full workflow. They are just missing our tool to capture that data. And they said, okay, it's amazing, fantastic. But what is your business plan? Who want to pay for this? Patients, physicians, system, government, who want to pay for that? So this is our main challenge right now. We are inviting all sponsor, mostly public government, because they should invest on prevention and it would be cost effective for them in long time. So for implementing what we want to create. This is knowledge base, valuable knowledge base. So we need some sponsor or grant or funds to support this project.
Yeah, for sure. And arguably, for self-insured employers, you would say that they also have a skin in the game to encourage these types of preventive assessment tools and the use of primary care, et cetera. So
Yeah.
I think there's many stakeholders that could win if it's deployed correctly. And so you've been doing this for a very long time. What are some of the emerging trends and technologies that you're seeing that could really make a significant impact in the next decade?
So this is the hot topic right now, AI.
Yeah,
But I love to emphasize that augmented intelligence rather than in artificial
artificial.
intelligence,
Hmm.
because this technology is coming to support healthcare system and augmenting the capability of healthcare system and healthcare providers. So back to personalized medicine approach and those 5 data domains that we need to capture all data to have a full understanding for each individual to providing personalized plan. So definitely we need AI to pass all of this data cleaning, data integration, data standards, all of them to help us to create knowledge and insight from the raw data. And without AI, we can't do that. Just one example. For only one domain, health related data, by 2025, we have generated 10,000 exabytes data. Each exabyte is 1 billion gigabytes. It means that just for one domain, we have created a 10 with 19 zeros bytes.
That's a lot of zeros.
It, what about we added omics, lifestyle, environment, social determinant of health? Without AI, we can't do that.
It's too much. It's too much.
It's too
So
much.
there's a lot of business to be had for the microchip companies. Right?
Right.
GPUs processing these things. That's why Nvidia stock is so high. The need is enormous, and the computing power that's needed to do this type of work is super important. But to your point, the AI work is crucial as part of it. Really insightful, and appreciate that number. I didn't realize it was so big. It's so big. Well, Abbas, this has been super interesting. I always enjoy visiting with super smart people like
Thank
you.
you.
What closing thought would you leave our listeners with? And what's the best place they could get in touch with you to learn more, to collaborate, become a partner, etc.?
Perfect. Thanks again for amazing opportunity you provided. So based on that personalized medicine approach, I just want to help our healthcare system by creating a tool to help us to put together all pieces of a puzzle for each individual to create a full picture of health profile for everybody. Because right now, these pieces of puzzle are fragmented, they are not available. But hopefully, by implementing and adopting the PAT tool and that data we want to create on top of that, because we want to map out all potential risk factors we can capture from the PAT with any potential disease and disorder. And this knowledge base is required for any AI platform. So by the whole phases of this project, hopefully we can create that picture of health profile for everybody. And hopefully we are welcoming for any scientific and financial support from all organization, private or public one. I'm always available on my LinkedIn, on my website, Abbas Zavar. This would be easy way. You can search it on abbaszavar@gmail.com for discussing any potential collaboration.
Amazing, Abbas. Really appreciate that. Folks, make sure you take advantage of getting in touch with Dr. Abbas Zavar. You can find all his information in the show notes. So take advantage of this super interesting collaboration to help all of us have a better health through preventative assessments. Abbas, thanks so much for being with us today. This has been a lot of
Thank
fun.
you. Thank you. I really appreciate it. Take care.
You too.